Hi everyone, hi viewers. Thank you so much for joining us yet again with another episode of Sihat Beyond the Clinic. So today is definitely an interesting topic, the one that has been going around in our social media platform. You've been seeing everyone talking about weight loss, and people are recently talking about how easy it is with certain medication and also certain surgery and all that. So today we have someone very special joining us. We have Dr. Sattian, gastroenterologist and hepatologist from Mawa Medical Center, who's going to be joining and speaking to us about ESG basically, and also how the entire weight loss journey goes on. So Dr. Sattian, would you like to introduce yourself on what you've been doing with Mawa Medical Center, and how has your journey been, and what ESG is all about in general?
Hi Rutrish, thanks for the opportunity. Hi, I'm Dr. Sattian Kolantavelu. I'm a gastroenterologist and hepatologist, and my special area of interest is bariatric endoscopy. As part of our service that we provide at Mawa Medical Center, it includes endoscopic sleeve gastroplasty, which is a minimally invasive endoscopic procedure, which means you use a scope to achieve the same weight loss technique, which is done by surgical technique. As we go on, Rutrish, I'll explain more, where I've even brought in the device to show all our viewers how the procedure is being done.
Absolutely, amazing doctor. Yeah, so they will have a chance to see what is exactly happening to them when they're doing ESG, and is it really something that suggestive to them and all that. So before we indulge into the topic of what ESG is all about, I think we can go on a little bit back on what obesity is and how is the obesity rate affecting Malaysians right now, and why is it important for us to keep a healthy BMI. So what is your opinion on this, doctor?
As you see, obesity is the new disease, which is not everyone has it, but then nobody is getting treated for. If you look at our data and statistics, in fact, every two Malaysians are considered overweight or obese. And we 100%. Are the champions in Southeast Asia, in fact, in one of the most obese nations in the world. But when it comes to obesity, we cannot just think about the current situation. We have to think about what will happen to a patient who's obese another 5 years, 10 years, 15 years, and 20 years to come.
Very true.
Because it will not only affect our health, it will affect the wealth as well, and also our well-being, and also all the incoming disease. As you get older, you'll have more disease, and with the obesity burden, the medical burden increases as well.
Yeah, very true. I think obesity is one of the biggest burden that we have in Malaysia right now.
Exactly.
And it's definitely becoming a global issue because with obesity, I think we're increasing the risk for cardiovascular diseases. Basically any sorts of NCD per se. Even you can talk about cardiovascular cancer and all that. And basically, if you look into the risk factor, the number one risk factor that anyone would actually go into superseding to any of these diseases is definitely obesity.
Exactly.
So Dr. Sattian, just to touch on, how does bariatric medicine, or per se endoscopy or ESG that we're going to talk about today, going to help us in managing weight loss?
Okay, before we go to that, I just want to highlight, obesity always been a problem in Malaysia, but especially after COVID, it got worse. Really
100%.
Got worse, yes.
Yeah.
Because our lifestyle, we were stuck at home. There's not much option.
All we can do is to continue to eat.
Yes,
everyone
and watch
on.
TV, sleep, and that actually exacerbated the whole situation.
Definitely.
And right now we are seeing all the effect. Okay, regarding your question, where does endoscopic sleeve gastroplasty play? Okay, ESG, we'll name it as a ESG. There are many terms for it, but when it comes to endoscopic sleeve gastroplasty, from now on we'll mention it as ESG. Okay, where ESG plays a role is there's already established plan for weight loss, whether it's a medical therapy or surgical therapy, but we need a bridge. There are patients who's already on medical therapy, lifestyle changes, who are trying to lose weight. However, after certain extent, they become plateau. They are not losing weight anymore. So at this situation, what will happen? Patient become frustrated, and usually they'll be managed by physician, endocrinologist, dietitian, physiotherapist to achieve the weight loss. And when this happens, medicine comes in. There's a lot of medicine that we are using now. GLP-1 inhibitors in the market. Those medications,
very famous GLP-1 right now, Ozempic and Mounjaro
but
right now.
I have to tell you, it's not cheap.
Yeah.
And it has side effect as well, but it works. But the problem is, whenever patients start taking all these medications, they will lose weight. However, when is the end game?
Yeah.
Because the moment you stop the medication, you're going to gain back the weight. In
It's
fact,
a very strong rebound response.
exactly,
When you
it
stop
goes
the
up to
medication.
50 to 60% within the first 1 year, and it's, in some places it's even higher, because we do not address the issue of endgame. At the same time, not many patients are keen to do surgery.
True.
Yes, but they want something, not an easy solution. Yes, some patient looks for easy solution, but they are genuine patients who has been trying to lose weight, but after a certain level they cannot lose weight, but they do not want to go surgery, because surgery in an obese person carries a high risk as well.
Very true.
Okay, so that's when endoscopic sleeve gastroplasty or ESG comes into a play. It is a minimally invasive medical procedure, endoscopic procedure. In fact, it will be done on the same day, and it does not involve any incisions. Most of the patient can go back on the same day or the following day, and right after the procedure, patient will be awake, and they can, in fact, if I do it in the morning, by the evening they can start be allowed orally as well. The procedure itself takes about 1 hour to 2 hours time, depending on the number of sutures and the complication of the procedure as well. And what will happen is, during the procedure, I will identify the location of the stomach where it needs to be sutured. Normally, we will suture it to make it closer. Means if the stomach is like this, when you suture, it will become closer to produce the same effect as the surgical bariatric procedure. Yes. And on average, there will be around 5 to 6 sutures that will be applied on the patient's stomach.
Okay, so before we go into the details of ESG, doctor, I think for the listeners per se, especially for those who are actually listening to this for the first time, can we go a little bit on what does a bariatric surgery actually do in terms of, like we understand that, we actually do a gastrectomy, but in terms of what exactly gastrectomy means and how is it very much similar to what we are doing with ESG? So I think just a little bit on that, so that, for the benefit of our listeners today, doctor.
Okay. So in an in a bariatric surgery, what will happen is surgeon, mostly upper GI surgeons, those surgeons are specialized in the stomach surgery, everything, they will insert a camera,
right,
and they will resect part of the stomach. So the stomach volume will be reduced by 70%, 60 to 70%. And of course, they will stitch it back, and then, the patient eventually go in a dietary restriction, everything. How it produces the effect is, when the stomach becomes smaller, the amount of food that patient can take becomes lesser. At the same time, they stay full longer period of time. Yes, of course, with the surgery, there are some hormonal changes that will happen to reduce the appetite and all those things.
Yeah, I think that's the most important thing, because what people do not understand is why people do bariatric is basically to, in simple terms, like we are cutting the stomach into half, and then we are actually trying to ensure that the amount of food that you're taking in is actually reduced at least by 50% to 70%, so that indirectly helps into weight loss.
Exactly.
And that is exactly the same that we want to achieve through an ESG procedure as well.
Exactly.
Right. Okay. So that is a very important one thing. That is one thing to understand what ESG is about. So who are the suitable candidates, doctor? So who should get this ESG done, or per se, how do we actually channel these patients, whether they should go for a medical therapy, whether they should go for a surgical or for minimally invasive ESG? How do we actually choose these patients, doctor?
Okay. So to begin with, ESG is not here to replace the surgery. It's
100%.
to complement the surgery.
Right.
So we need to choose our patients properly. So previously, when we started off, we were one of the pioneers in the country. When we started off, we just choose patients who are interested to do it. Later, we realized actually there are many factors that need to be addressed. This includes patients' lifestyle, patients' comorbids, what are the pre-existing medical they have. If you realize some patients, they genuinely have eating problem. No matter what kind of surgery you do, what kind of procedure you do, if you don't address the eating problem, the procedure is going to fail. And those patients that we choose is between BMI of 27, 28 to 40. Above the 40, yes, they still can undergo the procedure. However, the effect of the weight loss may be lesser. So this comes back to the question, doctor, how much weight can I lose? So when we choose our patients, you see, it's not patient chooses, we choose our patient. Because whenever patient does this procedure, we want them to have a maximal benefit.
Yep.
Okay. So what happens is, the average weight loss is around 15 to 17%. When it's combined with lifestyle changes, it can go up to 20%. And when it's combined with a medication, it can go up to 25% or more with a strict lifestyle. And this can be achieved together with medications as well. The patient will lose on average about 50% of the excessive weight loss. 50% of excessive weight loss in the first year.
Okay, wow, that's
provided they follow all the necessary lifestyle changes. So if those with overweight, morbidly obese, their BMI is more than 40, so they may not benefit fully from this procedure. However, when they have lifestyle changes, we handle a lot of other questions. We started them off medications, they become more active, they're able to lose at least 10% of the body weight, then they are not keen for surgery. Those patients will actually benefit from ESG as well.
Okay, yeah. I think that's pretty important to understand, because a lot of Malaysians out there, they actually think this can be a very straight way to lose weight, and they also think that anyone can go through the procedure. There's no such strict criteria, inclusion and exclusion criteria. So that's definitely one of the things that people are actually talking about. And I think, Doctor, you also mentioned about how quickly they can see the result. So do we actually have a time frame? That means once we have done the ESG, do we actually have a time frame, like the best results or the best effect is only seen after 6 months or 1 year?
So on average, patient receives somewhere between 6 months to 1 year to achieve the full weight loss. But immediate results can be seen in the sense that the weight will go down, it will become plateau. But one thing that everyone overlooks is the importance of inch loss. Your weight after certain time will become plateau, but you'll notice your clothes, everything become looser and looser. This main reason is because they have inch loss. They have redistribution of the fat and also the muscle layer and everything. So even though the weight remains plateau, you notice that the waist size that you have, everything, the inch will be losing much more significantly. And on average, so we started this first procedure in January last year, 18 January of 2025. That's one of the first set of procedures that performed in Malaysia. During that time, we have started patients of about 5 patients, and all of them for different group of medical background and everything. There are some, to be honest, there are some actually didn't lose much, but there are many actually benefited because they followed the strict lifestyle and everything. And after 1 year, when we look on average, they lost around 10 to 15%.
Oh, that's fantastic actually.
And most importantly, the weight loss is carried on. There were some actually, eventually when we got more procedures to be done, we found that we chose a wrong patient.
You know why? Because of the eating habit.
Yes. They lost the weight. They were initially following everything, but after a while they cannot control their appetite. They cannot. They have the eating disorder, which we realize is very important to
actually, that's definitely something that they have to address. And it's not just surgery. Once you have done the procedure, you have done the surgery, and then straight away, you have it as a permanent effect. So that goes into our next question, actually, Doctor. Many people actually worry about the complication, right? How safe is ESG? Whether, is it something that is going to cause me any sorts of harm? Will I have any side effects? That's number one concern for people. Another thing that they would also want to know, like, so let me take all the risk and do the ESG, but how permanent is the result? So how do we actually address that, Doctor?
About safety profile of ESG, ESG is a very safe procedure. The rate of complication is less than 12% because it does not involve any resection of the stomach. The main risk that we are always worried about is the anesthesia, the ubat bius. You are going to put the patient under sedation. That's why it's very important for the anesthetist who will be giving the sedation to assess the patient first.
Okay,
mainly we are worried about the sedation risk, but it will be minimized risk when the anesthetist already worked up the patient and do all the necessary tests. The other complication is from bleeding. But the thing is, whenever bleeding happens, it happens directly. And trust me, to stop the bleeding, we have the best device in the world to stop, because we just need to take a suture and stop the bleeding immediately.
Definitely.
Alright. Post procedure, what we are worried about is if patient is having excessive vomiting.
Right.
Yes, which is partly because the medication that's given to sedate the patient, and also from the procedure itself. Thirdly, of course, there's a small risk of bowel injury or gallbladder injury, but those are very negligent procedure. Compared to surgical procedure, which actually, to be honest, surgical procedure produces more weight loss, but it comes with a higher risk as well. It can go up to 5%.
Okay, all right. And how permanent are these effects in terms of once you have done the ESG, doctor? That means for how many years do you think they can actually sustain the weight loss, or for how long they can? So, for example, once you have done ESG, the first 6 months they have 20 kilos loss, and then after 1 year they have lost about 30 to 35 kilos, and then their body weight has gone down to maybe about 70 to 80. So, how permanent would that be, and what would actually drive into making that permanent actually?
Okay, so there are two parts to your question. Number one is how permanent is this procedure? Okay, ESG is a permanent procedure. The sutures are permanent sutures.
Right.
And once the stomach has been crumpled, let's call it crumpled, and made smaller already, eventually it will become fused already. Most important during this procedure is to take a full thickness bite. Means when we do the bite, the stomach, it needs to go through the whole thickness of the stomach, so that when you do it, it'll last longer.
Right.
And after a few months, actually, it'll become fused. It'll become give the same sleeve effect like a surgery when you resect the part of the stomach.
Okay, all right.
However, we need to be very sure that we take the full thickness. And number two, it is also reversible.
Ah, okay.
Okay, in the sense that in the initial part of when the procedure is performed, when the stomach's not fully fused, for some reason patient not able to tolerate or anything, you just need to go in and open the suture. It'll open back again.
Ah, okay. So that's pretty interesting to know. So if let's say right after ESG procedure, we understand that the patient is unable to tolerate, so we can reverse it as soon as immediately.
Within a month, within 2 months. Yes.
Yeah. So that's also something that a lot of our viewers would not know about it, but which is compared to a bariatric surgery, you
it's
cannot
one-way
reverse.
road.
Yeah, it's a one-way road. You cannot reverse, and if let's say you are unable to tolerate, you can't undo the procedure already. In that sense, I think ESG is definitely more safe than bariatric.
Another good thing about ESG is patients who have done ESG before, if later they choose to decide not only reverse it, they want to go for further surgical procedure, they can always go for it. Means you have done an ESG now, 1 year later that you think your weight loss is not enough, you want to lose more weight and you're ready for surgery, you can proceed for the surgery.
Oh wow, that's pretty interesting. That's pretty interesting. Okay.
And another thing is, when you already done an ESG, you have lost weight, and after number of years you start gaining back weight, you can perform another ESG.
Oh, okay, all right. I mean, that is also something that a lot of our Malaysians would not know, and definitely something very good to know.
Another
today,
one
doctor.
is, if you've already done a surgery before, either a gastric bypass or sleeve gastrectomy, which is a removal of the part of the stomach, and after a number of years you already start gaining weight, you can go for a revision to do another ESG to make it smaller.
Wow, okay, so there's a lot of options. We are not just stick with one single option, and we don't have to strictly confine ourselves into that particular ESG single time procedure.
Exactly, because everybody's think whether ESG is just one part. No, it has multiple roles to play. Like I said, it's not here to replace surgery, it's here to complement surgical procedure.
All right. Okay, so let's just quickly dive into how the procedure might feel like. Dr. Sattian today has brought in the ESG device for us today. So quickly, Dr. Sattian is just going to show what is actually ESG and what kind of device we're actually using during the procedure. So all to you, Doctor.
Okay, this is the device that we use for ESG. This device will be attached to the endoscopic procedure. So the whole thickness of the scope, everything is about the size plus your finger here. So most of the time you won't feel anything because you've already been intubated. And when the scope is inserted together with this device, it will go into the stomach where we'll identify and start suturing. This is the device that we use to hold the needle, and there's another device that we use to catch the tissue for the stitching. So after each set of the procedure has been done, we will actually insert a new needle that's to be inserted. The next video will show you how the entire procedure will be done.
Endoscopic sleeve gastroplasty, or ESG, is a weight loss procedure that reduces the size of your stomach so you eat less and feel full faster. It is performed by a specially trained doctor endoscopically, which means no incisions, no scars. For this procedure, the Apollo ESG system is a small endoscopic suturing device about the size of your finger that attaches to the end of an endoscope or camera. A specially trained doctor passes the device and camera through your mouth and into your stomach. The doctor uses the suturing device along the large curve of your stomach to sew it into a smaller shape. The stitches, or sutures, are placed in a U-shaped pattern starting near the bottom of your stomach and working towards the top of the stomach. As each U is completed, the suture is tightened down to reduce the volume of the stomach. The doctor continues to sew along the large curve of the stomach until 6 to 8 sutures are completed. With your stomach sewn into a smaller shape, you'll eat less and feel full faster, resulting in significant weight loss. See the difference. Patients lose an average of 14% of total body weight at year 1, or 49% of excess body weight. This advanced endoscopic procedure does not require incisions, meaning no scarring and less time away. Most patients typically go home the same day as the procedure and can return to work in 2 to 3 days. The Apollo ESG system is the first and only device to be authorized by the FDA to perform ESG for weight loss. It is indicated in adults with obesity, with a BMI between 30 and 50, who have not been able to lose weight or keep weight off with diet and exercise alone. Patients who have an ESG must also pursue certain lifestyle modifications, such as changes to diet and exercise, in order to achieve desired results. All procedures have risks. Talk to your doctor and understand all risks before having a procedure.
Alright, okay. So that is definitely something very interesting to see, and I think we had a very exclusive video of how Dr. Sattian has done the procedure of ESG to a patient. Now Dr. Sattian, so very important question is that where do you see the future of obesity treatment going? Where do you see ESG's role in the next 5 to 10 years? And do you think countries like Malaysia or, for example, the Asian region, how would they actually adapt to procedures like this? And do you think there's something new coming up in the market replacing ESG as well?
Yes. Okay. So if you look at the current trend in overseas, obesity has already been recognized as a disease. When you've already been properly worked up, everything is actually covered by insurance.
Right.
Unfortunately, in Malaysia, it's not to that stage yet. We are still addressing all the non-communicable and communicable diseases, but we have not addressed obesity. We have not officially recognized obesity as a disease. Those many patients who actually deserve to be treated, they are stuck because they have insurance, but insurance does not cover for all these procedures, unless certain insurance only provides that.
Yeah, very true.
So moving forward, once we're able to convince the insurance, see, if you don't treat this now, in future we're going to have more problems, everything, then hopefully more patients will get treated. Right now, most of them they pay out of their own pocket.
Yeah.
Okay, or either that they get a EPF withdrawal and things like that. Okay, moving forward, I think ESG is here to stay, and it is here to complement with all the other procedures. And in future, most likely it's going to be a hybrid. Hybrid means you're going to get the medical treatment,
ESG?
you're going to get an ESG or balloon. We forgot to mention about balloon.
Okay, balloon.
So a balloon is there to complement. Sometimes what we do is, when a patient is morbidly obese, they have very big size, everything, and this patient needs to lose weight. See, we know ESG provided around 10 to 15% of weight loss. It can go up to 20% also with strict diet, everything. And when you combine with medication, you go 25%. Right. So some of them may opt to add the balloon first. You use the balloon, you will lose around 10 to 15% weight loss.
Yeah, almost
then,
immediately.
Yes. Of course, it's not permanent. So when you take it out, they'll have a rebound. To prevent that rebound, we do the ESG together. Patients already on medication. So it's going to be a hybrid.
Yeah, that's more efficient for patients as well, and it will ensure that it's not something that's just gonna give you a small lasting effect, but it's actually a long lasting effect.
Exactly. Yeah. So most of my patients, rather than doing the procedure and following up, I put all of them on follow up first. Okay. So when they come into us, we put them on dietary restriction. I get to see my endocrine, put them on a low caloric diet.
Right.
And then when start losing weight around 10%, if they're diabetes, we try to change your medication to GLP-1 inhibitor. Yep. So when they achieve around 10 to 15%, they become really motivated. That's when we'll do the procedure.
Okay. So that motivates the patient. So you ensure that their lifestyle is already changed, so that after the ESG procedure, it continues in that way, that they maintain their lifestyle.
Exactly. It's more important as well. Our patients are our ambassador.
Yeah, 100% of
Yes, if they do not for many reasons, if they do not lose weight, it creates not a very good impression on others. Maybe they will start questioning whether there's a right procedure to be done, whether they rushed into the decision, or whether there are other options that could have been done.
Rather than making the procedure by itself.
Yes, because the procedure itself is not cheap.
Yeah.
It is comparable to a surgical technique.
Yeah. So touching back a little bit on what you mentioned earlier, Doctor, I think I very much echo to the part where you said health insurance should actually recognize this as a disease, because once you have recognized that obesity is actually the major cause of causing all the other NCDs and the major other two cause of death mortality, which is CVS and cancer in the world, I think we can start changing the entire landscape of how the entire disease burden is in the country. I think this is definitely a G to G decision that we have to make and adapt into Western practices of making sure that this kind of covering for obesity treatment is definitely something that's going to be beneficial to the community.
Exactly.
Yeah. So a little bit that now I want to touch on. So how much do you think this minimal invasive procedure costs, Doctor? So in terms of, it can be a very general range or in terms of very specific range. So how would you advise on that, Doctor?
At the moment we have let me speak about how we run it in Mawa. Okay, so at the moment in Mawa, we have packaged it as in 5 sets of sutures and additional sutures if necessary. So it costs around 25,000. With additional suture, probably 1,000, another 2,000 ringgit. Okay. So on average, patient requires around 5 sutures, and this already includes all the admission. Patient normally admit on the morning of the procedure.
Okay.
And it includes all the device, the sedations needs to be used, and normally they'll be given a single premium bed.
Okay.
And this includes the medication that will be given, and the following day, when they already reviewed, they can be discharged by the afternoon, seen by dietitian, they start taking orally, and includes the discharge medication as well. Okay. So normally I tell my patient you can estimate between 25k to 27k.
Okay, all right. Okay, so that is definitely something that's definitely one of the take-home messages that we're going to take today about how the cost would look like for the treatment of ESG. And this is for the sake of our listeners, for those who actually want to go down this journey, those who are feeling that they are already at the level of obesity and they want to have a weight loss journey, what would be your key take-home message today to them, Doctor?
So weight loss is a journey. You can actually, in a journey, you can rush into a place without enjoying all the sceneries, everything, but you may not actually know the value of the journey. However, if you decide that it is something that worthwhile taking, do not rush into any procedures. What you should do is get a proper advice. There's no shortcut for weight loss. Get a proper advice, treatment, dietary plan. Get you seen by a proper doctor, dietitian who are trained in weight loss.
100%.
And also have a plan for end game. That's very important. When you start taking medications, you cannot continue it forever. Either it's going to be stopped by the limitation of how long you can take the medication, the cost, or the side effect of medication. And when you stop that, you need to have further plan what needs to be done.
On what to be done.
Yes.
Yeah.
So if you enjoy the journey properly, you'll arrive at the destination safe and sound. The same thing goes for weight loss as well. If you plan it properly, at the end of the journey, you'll have something beneficial to carry on for the rest of your life.
All right. Okay. So with that, that marks the end of our podcast session today with Dr. Sattian. Thank you so much, Dr. Sattian, for sharing the insights on how ESG and how a weight loss journey should be for any Malaysians out there. So for those who want to know more about, weight loss and in terms of what ESG, bariatric medicine, and in terms of all this drugs and medication that is coming around the obesity treatment landscape, so you can actually search for Dr. Sattian, and you can actually log on to Mawar Medical Center to know more about it. And thank you so much to all the listeners for listening. This is Sihat Beyond the Clinic. Thank you so much, everyone.
Thank you. Saya Dr. Sattian, pakar perubatan gastroenterologi dan hepatologi dari Pusat Perubatan Mawar. Baru-baru ini, kami telah berjaya menyelesaikan program proctorship untuk endostitch, endoscopic sleeve gastroplasty di Pusat Perubatan Mawar dan diiktiraf sebagai pusat perubatan yang pertama di Malaysia untuk menyelesaikan program latihan ini. Kami telah melakukan endoscopic sleeve gastroplasty atau teknik bariatrik tanpa pembedahan yang pertama di Malaysia ke atas 5 orang pesakit di bawah bimbingan Dr. Ravi Shankar. Teknik ini menggunakan sistem endoskopi untuk membuat rawatan bariatrik tanpa menggunakan apa-apa pembedahan. Kesemua 5 pesakit kami telah di-discharge dengan sihatnya pada hari keesoknya. Kami juga akan melakukan prosedur seterusnya pada masa hadapan dan kami akan memaklumkan perkembangannya seterusnya.